Hi friends, Namaste. So I have with me today our orthodontist who's going to be in-house, and this is Dr. Tejas. So an orthodontist is a dental super specialist who takes care of your teeth in order to give you that smile by aligning the teeth. There are many different ways of doing this, from the conventional brackets to the ceramic brackets to lingual and so on and so forth. There are aligners and many things. So what I just want to tell you here is, so he's very well trained and we have an excellent equipment. We have a very good setup that can take care of the patient's teeth, align them with latest software and other things. I'm going to let him tell more about this. So this is going to be an added benefit to our patients who are seeking various cosmetic, aesthetic, functional treatments on the head and neck region. Apart from that, his role also comes in the planning of various bi-jaw surgeries, because we need to get the patients finish off with a lot of these surgeries with braces, with aligners. So that's another role that he's going to play with us as an integral member of our team. All right, so Tejas, can you tell our viewers, because they want to know probably about how, like the software you use anymore, how the latest software can help them get that $1 million smile, alignment of the teeth, and also how it can be done without someone else knowing that they've got it done.
Yes. So basically, when we speak about aesthetic or treatment, it's always a holistic approach. So it goes hand in hand. So sometimes people, they have different queries, they have different needs. So we cater to such specific needs. So when you come to us right now, what we do is that we get a scanning done. So it's a digital scan. So this goes to our software, and this software is very accurate. So from this, we plan your tooth movement exactly to the place where it should be. So the malocclusion are different in nature. So for that, we need to customize. So then we execute a plan, and then we show you what all steps and how to go about it, what all the things you should be aware of, and the total time duration. So after that, we give you the trace so that you can start the invisible journey with us.
Awesome. So what he's basically saying is, you don't have to get those material in your mouth to take impressions, right?
Yes.
So those days are gone, like
no
forever.
Gagging,
no gagging,
no irritation,
nothing in the mouth.
Yes.
All you get is like a photograph or scans on your mouth, and then he plans on the software as to where your teeth should be finally, and then you make the splints.
We make the
3D
models, and
then he makes the models, and from the models you make the trace or the ones that aligner trace, and then it's given it to the patient.
Yes.
Absolutely perfect. So this is something that I think revolutionary, and because we have a 3D lab set up right here in our first floor that has all the equipments that you need with all the softwares that he needs, so you're able to get all of this done. Like, how long does it take, maybe time wise?
It's barely minimum 10 minutes.
So it's like it's that quick. So that means that you could fly in from any part of the world, get your aligners done, and go back, and then he can follow. So we already have some patients that we're treating in other cities, and that's to tell you that when you go back, so you're having a system of a video consultation for them, and then those trays, if you want, we can send some new ones. Anyway, there's much more you can learn about this, how we're able to do this for patients from anywhere in the world. All right, so apart from this, you also told me that there are some patients that are surgical, or that some need more aggressive or major treatment, ortho treatment. Then you can put some braces inside on the tongue.
So this software lets us do multiple things. It's not only aligners. So basically it gives us a topographic view of the tooth. So the inside layout, the inside structure of the teeth, the curvature of the teeth. So the entire data is shown. So in this, what we do, we provide a customized bracket so that you can place on your inside. So little more difficult movements where aligners sometimes fail. So these can be easily done with lingual.
So I myself have been learning a lot of these things. We are having tie-up with Dentsply, Sirona, Formlab, some of the brands that are the world leaders for this type of treatment. And since my expertise and specialty and passion is surgery, I've not been doing a lot of these patients, and now Tejas is going to take off from here, and I think it's going to be very, very useful, absolutely boon for a lot of the patients who need to get any kind of alignment on the teeth, and also let our viewers know about the costing, because we have our own 3D lab,
yes,
and we have our own software,
Yes,
which we're using it, like you said, for multiple things. So the cost per treatment is going to come down,
yes,
right?
sir. Drastically it will reduce.
So that's another good thing for you. So anyways, if you have any more questions related to anything in orthodontics, aligners in particular, do drop in a message. We'll get doctor to answer you. Our team will be more than happy to answer them. And we're going to give you more updates on this field regularly. So keep following our channel to get to know more and see how that's going to be more useful for you. Thank you for watching.
Thank you so much.
Thank you, Dr. Tejas.
Thank you, sir.
Bye.